everyone. Thank you so much for joining. This is a big day for me. It's my published date for my new book, The Antiviral Gut, Tackling Pathogens from the Inside Out. And I'm so grateful to all the people who've been supporting me, to folks like Rich Roll and Sean Stevenson and Liz Moody and all the rest. There are too many to name, but I've had the pleasure of being on so many wonderful podcasts, reconnected with old friends, made some new ones, and really the quality of work that so many of these podcasters are putting out there is incredible. And I see it as like a megaphone that they provide for the information that physicians and scientists are creating, and then they sort of are able to transport it to a broader audience. So thank you everyone for your incredible support of the book. So today's office hours is really about the gut, the microbiome, and viral infections. I know I normally talk for a long time, but I want to make sure that everybody has a chance to get their questions answered. And the only thing I'm going to say is that if you don't remember anything about having an antiviral gut, I want you to remember these three things. Stomach acid, there for a reason, not just for digestion, but to denature viral proteins. Think twice before you block your stomach acid. Gut lining, you need an intact gut lining to protect you from viruses penetrating through, getting into the bloodstream, traveling to distant organs. Think twice about taking non-steroidal anti-inflammatory drugs. Take care of your gut lining so it can take care of you. And finally, your gut microbiome. How do you create a healthy microbiome? I wrote a whole book on that called The Microbiome Solution. There's plenty in this book too, but think less about going to the store to buy microbes and more about how you can encourage the growth of healthy microbes within your own gut by feeding them. And remember the data from the American Gut Project, diversity of plants matters, 30 or more different plant foods per week. It's a way to build a healthy gut. Lots of fiber. So I'm literally going to stop talking and make sure that I get to questions. So let's see what we have. We have lots of people on, lots of new people from California. Good morning. So nice to see you. And it's a little bit earlier for you, so thank you for joining us. Oh my goodness, your copy is going to arrive in a few hours. I cannot wait. So here's a great question. What do I think about probiotics? I think about probiotics a little bit the way I think about vitamins. They can be useful in a specific setting. The patients I see with Crohn's and ulcerative colitis often have vitamin nutrient deficiencies. For example, with Crohn's disease, if you have Crohn's in the ileum, it can mean you're not absorbing vitamin B12. And in that setting, we need to replace the vitamin B12. There are people who have low vitamin Ds. So in a specific setting, there is definitely a role for vitamin supplementation. And I'll say that also applies to probiotics in a specific setting. For example, for my patients with ulcerative colitis, we use high doses of a prescription probiotic as a medical food, and these patients do very well on that. But I never use probiotics on their own without dietary change also, because I'm very focused on what we're feeding these gut microbes. So if you are feeding your gut microbes, Cheetos and cheeseburgers, there's no amount of probiotic that is really going to affect meaningful change. So it's a balance with the diet. And there's specific probiotics that work for different things. So for example, a condition called necrotizing enterocolitis, which is a serious inflammatory condition. We can see it in babies and in later life too. There are specific probiotics for that. There are specific probiotics for traveler's diarrhea. There are specific probiotics for Clostridium difficile. So just taking a general probiotic is probably not the best strategy. So I really recommend that, Claudia, that you really think about what it is you're trying to treat and get some advice from somebody who's experienced, ideally a gastroenterologist who is experienced with using probiotics. For the average healthy person, we're not really seeing a lot of evidence that a probiotic on its own will make a difference in the absence of dietary change. Okay, that was a really good one. Thank you for getting us started with that. What else do we have? Plant-based wave from Spain. Hola, ¿qué tal? Bienvenidos. Okay. Do juice fasts help or hurt your microbiome? From Julie. Julie, that's a great question. What I want you to remember is that when you are juicing, you are removing the fiber. I have a juicer, a Breville juicer. I don't use it very much. I almost forgot what brand it was because it's been such a long time. And when I juice, all that fibrous stuff that you throw out, that's actually what you want to be feeding your gut microbes. So, a juice fast can be a great way to just sort of lighten things up. If you're feeling constipated and you want to just be taking in less, and you do a 24-hour, 36-hour juice fast, if you medically can handle that, that can be great. But juicing as a regular strategy for building your microbiome deprives your microbes of the very food that they most desire, which is a fiber. So if you're doing a juice fast, you may want to think about then taking all that fibrous debris and ingesting it in some way. So I wouldn't say they hurt your microbiome unless you're doing it for a prolonged period of time and you're really not getting in those fibrous foods that you need. Okay, hi South Florida. I'm down in Miami all the time. Love it down there. I hope you're doing well. Raw sprouts for Gut Health Daily. Absolutely. Broccoli sprouts and others are fantastic. These are living foods. So in addition to being high in fiber, they're high in polyphenols. Absolutely. Great idea. Salads and your smoothies, however you can get them in. Love it. Okay. What else do we have? Hi, Rosa. You had the virus 6 months ago. I'm sorry to hear. I hope you had a good recovery. You got bronchitis 2 months ago and had to take antibiotics for the bronchitis. What should I take to restore my gut? So I want to discuss that line, had to take antibiotics. Remember that lots of bronchitis is also viral. So bronchitis does not equal antibiotics. Pneumonia does not equal antibiotics unless they are sure that it is a bacterial infection. Now, I don't want to make you feel bad about that because you already took the antibiotics, okay? But in the future, if you have bronchitis, remember that bronchitis is often part of a post-viral syndrome. So many people after COVID, after all kinds of viral illnesses, will get bronchitis, or even after a bacterial infection has resolved, you can be left with a tracheobronchitis, a sort of reactive situation. And even though that can last a long time and be really sort of horrible to deal with, it's not something that necessarily requires antibiotics, okay? So I want to make that point. What should you take to restore your gut? Okay, I would love you to work in some fermented foods. You don't have to eat a lot. A tablespoon of sauerkraut can provide more than 2 billion live bacteria, can provide more than 24 different live bacterial strains, in addition to more than 2 billion live bacteria. So I want you to think about a tablespoon of sauerkraut or some kimchi. I don't personally love the kimchi as much, but I do like sauerkraut, especially one with some tart apples in it. That can be really helpful. The other thing that you might want to think about doing, especially if you are somebody who has been prone to yeast infections, would be to cut down on the sugary, carby, kind of simple carbohydrates like the baked goods, the pasta, the bread, the cookies, the cakes. Cut down on that because that is typically encouraging the growth of less helpful species. If you are somebody who has suffered with yeast infections in the past when you've been on antibiotics, you can eat some sort of anti-yeast foods, which would be things like pumpkin seeds, rutabaga, coconut oil, seaweed. Those can all be really helpful. You can make a mushroom tea, maitake or shiitake mushrooms. Take 2 dried mushroom caps, chop them up, add about 3 to 4 cups of hot water, steep it. You can sip on that throughout the day. That can be really helpful. Make sure you are not taking an acid blocker on top of an antibiotic because that's doubly disruptive to your microbiome. Make sure you're supporting your liver before, during, and after an antibiotic because these drugs are typically metabolized through the liver. So that would mean cutting down on alcohol. It would mean eating a lot of green leafy vegetables. The brassicas are really great for supporting liver health. So those are some of the things that you can do. You may want to consider a probiotic in this setting if you're feeling like, your gut took a hit from the antibiotics, and typically about 60 to 90 days would be helpful there. But I want you to promise me the next time someone is prescribed an antibiotic that you are going to say to them, is this antibiotic absolutely necessary? What would happen if I didn't take it? What would the natural course of this illness be without an antibiotic? Could I get the prescription filled and keep it and start it if I have worrisome symptoms? What would those worrisome symptoms be? There's so many questions to ask. They're all in the book. Okay. Let's see what else we have. Hello from Kenya. What natural herbs do I recommend? That's such a great question. In terms of antiviral health, or really sort of tackling viruses, there's not necessarily great peer-reviewed, randomized placebo-controlled data, but there is great anecdotal support for things like echinacea and lavender, particularly if you are fighting a mild viral illness. Lots of people benefit from that, and it's not harmful. Lavender for sleep. So those are some of the things that can be helpful that, I'm all about do no harm, primum non nocere. It's one of our Hippocratic Oath tenets, if you will. And so if there's something you can do, like a little echinacea or some lavender for sleep that makes you feel better and does not harm you, then I think, that's a great thing to do. I'll tell you that for me personally, if I have a little virus, and remember, having an antiviral gut is not about never having a viral illness. It's about having mild symptoms, making a full recovery. Okay, so it's about increasing our resilience. But I want to remind you that having an occasional cough or cold is actually an important part of training our immune system to be more resilient and to recognize friend from foe. So the goal is not never being sick. The goal is mild, self-limited infection, okay? When I'm struggling with something, I love to take a hot Epsom salt bath, and I will typically use Epsom salts that have elderberry or lavender and really hot water, and it's not scientific, but it feels like it helps draw things out of me. Again, very unscientific. But speaking of drawing things out of you, I do want to point out that the skin, the urinary tract, and the gut are three of our main organs of elimination. And, particularly the gut, when we think about viral infections, we excrete viruses. So when we ingest them and they get into our body that way, one of the ways we eliminate them is through the feces, fecal shedding. And we know that fecal shedding of viruses can continue for sometimes weeks after we're testing negative from our nasal swabs, etc. So we're still eliminating virus, sometimes even after we can't detect it that way. And how do we improve elimination through fecal shedding? Water. To help move the products of digestion from north to south. And with the products of digestion, I'm also including viruses that you may have ingested, okay? How do you start a healthy gut routine? I think you just start. And I would recommend thinking about my 1-2-3 rule that I've used with patients for 2 decades now. So that's 1 vegetable in the morning, 2 at lunch, 3 at dinner. Because increasing the plant fiber in your gut is a really essential way to increase the population of those healthy microbes. So if you're having eggs in the morning, add some spinach. If you're having, fruit, add a carrot, stick after, okay? So 1 vegetable for breakfast in the morning. Do 2 at lunch. So that could be easy. If you're having a side salad, lettuce, tomato, you're done. 3 at dinner. Now these need to be all 6 different vegetables, okay? Because we're trying to get to that 30 different plant foods per week with the American Gut Project. So dinner, what I recommend is if you're having a small side salad, also have some sort of vegetables. So 1, 2, 3, that's 6 servings of vegetables. That will go a long way. I flip it for myself. I tend to start my day with a green smoothie. I didn't this morning because I got a bit busy, but generally I'll do a green smoothie with coconut water, 2 greens, usually collards and kale, or spinach and collards. I'll throw in some celery, some parsley, a squeeze of lemon, and always some fruit, usually mango, pineapple, whatever I have on hand that's fresh, or I usually have some frozen pineapple in the fridge. So I make that green smoothie, try and get as many of those plant foods in. I think the highest amount I've been able to get in was 11. I got 11 different plant foods in to my green smoothie one day. So I would really, Claudio, think about the food as a way to start a healthy gut routine. The other thing I would recommend is taking a really good look in your medicine cabinet. Because so often we think of the medicine cabinet as a place to go find a cure, but when it comes to the gut, unfortunately, it can be the cause of the problem a lot of the time. Prescription drugs, over-the-counter drugs, supplements, be sure that they are not potentially harming your gut lining or gut bacteria or affecting stomach acid. And I recommend that same judicious approach to medications to apply to supplements and over-the-counters also. Okay, it's not just with a prescription drug. So that's a really good place to think about starting too. And then the other thing is just how to quiet down your body a little bit. That can be very helpful for gut health. So trying to activate the parasympathetic system and deactivate the sympathetic nervous system, getting a little bit of quiet time, great for gut health, great for digestion. I hope that was helpful. Okay, what else do we have? Oh, thank you so much, Hearth Wild. Thank you. Let's see what else. H. pylori not going away. Why? Well, the first thing I want you to make sure is that H. pylori is actually a problem. So we don't routinely screen for H. pylori in the population because it turns out that some people are colonized with H. pylori for a reason. If you have H. pylori and you also have inflammation in the stomach, or you're having a lot of gastric symptoms, that might be a good time to eradicate it. But if you're colonized with it and it's not causing a problem, we are not as aggressive about treating it. The acquisition rate for H. pylori, and for those of you who don't know, that's Helicobacter pylori, a bacteria that lives in the stomach. The acquisition rate is 10% per decade. So if you're 40, you have a 40% likelihood of having it. If you're 80, you have an 80% likelihood of having H. pylori. Obviously, there are many people walking around in society with H. pylori who are not dropping dead of stomach cancer. So there are particular circumstances where H. pylori can be a risk factor for gastritis, for inflammation of the stomach, and for cancer. And that is typically when we can see surrounding inflammation in the stomach. So you also might want to think about how they are determining eradication. There are different tests for H. pylori. There are breath tests, there are stool tests, there are blood tests, there's biopsies through endoscopy, and there are varying degrees of sensitivity and accuracy. So I would also have a conversation with your gastroenterologist about how they are determining whether the H. pylori has gone away or not. Of course, an endoscopy with a biopsy would be the gold standard, but that's also the most invasive. Okay. Immunodeficient patients seeking gut health consultation. What is the best approach? Yeah, really depends on what the immunodeficiency is. If you have, for example, something like severe combined immunodeficiency or HIV, I really recommend having an immunologist on board also, because believe it or not, there's certain probiotics that in people who are immune deficient can actually cause a problem, can cause quite serious problems. So that's one category where I really exercise caution in recommending probiotics. At the same time, probiotics can be extraordinarily helpful in particular settings in terms of helping with the immune response. We saw a study from Italy early on in the pandemic where hospitalized patients were treated with particular high dose of a certain probiotic, and that group versus a group who didn't receive these had better outcomes in terms of needing ventilations, ICU, etc. So, it can be a huge help, but it can also be a hindrance. So if you have a documented immune deficiency, really a great idea to have your immunologist on board coordinating with your gastroenterologist over any particular treatment. Best fibers. Okay, so the best fiber, of course, is the one from food, right? From fruits, vegetables, nuts, seeds, whole grains, etc. The next best fiber is psyllium husk, is one I use a lot in my practice. And it really depends on what you're trying to treat. So if you have diverticulosis, for example, I love psyllium husk because and that's Psyllium. It's like a broom that just sweeps all those little holes, the diverticular orifices in the colon clean. If you are constipated, I love a little psyllium husk in the morning and a little magnesium at night. Perfect. If you are having too frequent bowel movements, sometimes psyllium husk can kind of consolidate those into fewer, more solid stools. So psyllium husk can be great, but not everybody tolerates it. Some people find it just sort of clogs them. If you have a voluptuous venous colon and you have a lot of twists and turns to your colon, or if you have a voluptuous venous colon and you're male and you have a lot of twists and turns to your colon, not just in women, sometimes that psyllium husk can get stuck at those, hairpin turns and feel a little clogging. Some people can feel almost like a choking sensation when they're drinking it. You do have to mix it with a lot of water. I recommend a tablespoon of psyllium husk mixed in 8 ounces of water. Drink it down briskly, and then fill that glass, get the dregs with another 8 ounces of water, drink that down, and then try and drink more water after, and taking it in the morning, because you need a lot of liquid to get that psyllium husk down through all those many feet of small intestine down into the colon where you need it. So I love psyllium husk in certain situations. For my patients who don't tolerate psyllium husk, I love acacia fiber, A-C-A-C-I-A. Did I spell that right? A-C-A-C-I-A, acacia. It's spelled like acacia. And that fiber is soluble, dissolves completely in water, odorless, tasteless. I have put it in coffee and tea before, just testing it, and it dissolved completely. It is not as robust as a psyllium, and I typically will have people do a teaspoon dosing kind of throughout the earlier part of the day initially, and then consolidate it. I have patients who use both psyllium and acacia. I was recently introduced to baobab fiber, and I'm really very curious about that and anxious to try that out in myself and in some patients. So there are lots of different fibers, but of course, it's sort of like nutrients in a vitamin, right? You want to get the nutrients from the food. So ideally, you want to get the fiber from the food, and think of the fiber supplement as just that, a supplement, if you are having trouble getting in enough fiber from the food. But I would say my two favorites would be psyllium and acacia. Okay. What kind of juices? So again, I'm generally not a fan of juices because they don't have fiber. I'm a fan of smoothies, blending instead of juicing. But if you are going to juice green vegetables, sweet potato, things that are lower, aren't going to spike your insulin levels as much as apple juice, for example. Okay. How do you start a child with gut problems to a better gut? Again, Claudia, I really think the diet, and this can be so challenging. I know when my daughter was little and had gut problems, it was hard. It actually got harder when she became a tween and was like, nope, I'm not having that. Because when she was really little, I'd just be like, oh, delicious lentil dal burger. Here you go, green smoothies. But as they start to exert more of their own will, it can become more challenging. And here's the thing, a lot of that is the palate. If you have a child who has been on a lot of antibiotics or been on a lot of acid blockers or not eaten a healthy diet, their palate, a lot of that is informed by the bacteria in their gut. And so they may be craving that sweet, starchy food all the time, and they may really be rejecting the more bitter taste of the vegetables. So a helpful thing if you're dealing with that is to make a smoothie and make it mostly fruit, berries, bananas, but put some greens in. It was certainly what I did. It worked well when my daughter was little. I would put spinach in. It doesn't really change the taste, but it changes the color. So it makes it from sort of that pink color to like a muddy color. And so I would literally put it in an opaque mug where she wasn't really seeing the color as much, or an opaque bottle. And over time, I would gradually increase the amount of greens and decrease the amount of fruit. And you have to do what you have to do to get them to get this food down, because it's not so much the presence of, goldfish and yogurt that's a problem with kids. It's the absence of the green leafy vegetables, the fibrous vegetables, etc. So I would try to really focus on just getting a little bit of that into them every day. Maybe it is 2 or 3 broccoli florets. Maybe it's half a dozen green beans, and really getting them, I don't know how old your child is, but really getting them into this idea that this is part of the meal, right? That the meal has different parts, and that these vegetables that may taste a little bit different and may not taste as delicious all the time are an important part of it. And I think that's a great way to sort of ease them into it. Okay. Best source of fiber for women in 40s. Hi, Jamie. So again, psyllium husk is one of my favorites, but it depends a little bit, Jamie, on what you're trying to accomplish. So if you are constipated or you have diverticulosis or you're irregular, psyllium husk can be great. Plenty of water with it, okay? On the robinchutkan.com website, in our gut guide on diverticulosis as well as constipation, but even better for you, Jamie, and for everybody, on the robinchutkan.com website, on the homepage, we have this free downloadable guide to constipation. This is a 78-page book, essentially, that I wrote, and I have to say it's terrific. So I go through all the different causes of constipation, bowel irregularity, bloating, and then all the remedies, and I do go into detail there about the fiber and how much and how you mix it up, etc. So you can download it. It's a free PDF. Okay. Thank you for these nice compliments. Thoughts on the specific carbohydrate diet? Steph, thank you so much for asking that. Yes, SCD, the specific carbohydrate diet, is a relatively low complex carbohydrate diet that was popularized by Elaine Gottschall in the 1980s, I believe. She used that diet to help her child who had colitis, or I think it's not clear now whether her child may have had celiac disease or colitis, but at any rate, but it's a diet that has been around for a long time. And while it is sort of a first or second cousin of a paleo diet, it's all in the interpretation. We have used this diet very successfully in our practice for our patients with inflammatory bowel disease, but we published data from a retrospective trial of people on SCD back in 2014, and we found something really important. We found that the response to the diet, and by response we meant mucosal healing from inflammation, getting off medication, very important endpoints, we found that that was directly proportional to the amount of fiber in the diet. So you can interpret a specific carbohydrate diet as bacon and eggs for breakfast, chicken for lunch, steak for dinner with 2 broccoli florets, and you would be within the confines of the diet. But we found that people who were using it in that way, who were really limiting the carbs and maximizing the animal protein, really didn't do as well in terms of getting into remission for their inflammatory bowel disease versus the patients who were doing a green smoothie in the morning and a salad for lunch and maybe something with animal protein and steamed vegetables or something for dinner. So I think there is a lot of maneuverability with that diet. And, you know, I do a lot of speaking within the vegan community, and people will sometimes say, you know, that diet, it's not like our people, that diet. But here's the thing, when you are using food as medicine for people who are medically ill, there are the moral, the ethical, the aspirational aspects of whether you eat animals or not. And then there is a medical reality of helping somebody who has a chronic debilitating autoimmune disease and is trying to get that disease into remission. And I will tell you that in that setting, I have found, as a gastroenterologist who's been practicing for more than 30 years, that there is room for animal protein on the plate for those who want it. And it's very important to me as a physician that I have an approach that is very welcoming and encompassing for any patient who is under my care. This is not the time for me to lecture people about climate change and, you know, when somebody is having 20 bloody bowel movements a day and has lost 30 pounds and is trying to get their Crohn's into remission. So I really try and meet people where they are. And for a lot of people, that includes having some animal protein on the plate. And in my experience as a gastroenterologist treating these patients with complex autoimmune diseases, that has worked fine. But that has to be accompanied by maximizing the plant fiber, really thinking about what whole grains they can tolerate. So, you know, as you know, on SCD, there's not a lot of whole grains, but as soon as people are feeling better, I will typically add back in brown rice, quinoa, oatmeal. So I work with each patient individually. And the question I ask is, I say to them, what are you missing? What do you mean? You know, you've been on this diet for 16 weeks and your Crohn's is in remission. Woohoo, we're really happy. But what are you missing? And sometimes it's hummus. Sometimes people are like, you know what? I love being able to have carrots and hummus, and it's such a convenient, easy thing for me. Sometimes people miss their oatmeal in the morning. Sometimes people want to have some brown rice pasta. It's probably not going to be gluten pasta on the menu. So I really try and work with people on what they're missing, and then we ease it in bit by bit and see what they tolerate. And then it's like, okay, you tolerated that, great. Like, let's go on to the next thing, because my goal is not to put people in food jail. Food is delicious and joyful, and it serves a medicinal purpose for healing the gut and feeding our microbes, etc. But there's also ideally a great amount of pleasure associated with it. And so, you know, in SCD parlance, you talk about what foods are legal and illegal. And I don't like talking about foods being legal and illegal any more than I like talking about people being legal and illegal. I like to have a more all-encompassing approach. But that being said, you know, there are, as you know, when you're starting off with a diet in the induction phase, it's pretty strict. And I'll start people in that induction phase when their gut is really inflamed, because that is often a time when they're not tolerating a big, huge kale salad, right? When your gut is super inflamed. So generally, specific carbohydrate diet, I found it a very useful part of my practice. I almost always modify it. try and increase the fiber content, try and decrease the animal protein content. That was a long answer for you. Okay. Hi, Lottie. Crohn's, I'm going through early menopause. Will hormone therapy hurt my gut and make my Crohn's worse? It's such a great question, Lottie. And, it can, is the answer to that, but it's very individual. So if you're having, terrible menopausal symptoms and you feel like you need some relief for that, it may be worth trying. On the other hand, if the menopausal symptoms are not terrible, you could try topical therapy. For example, estradiol, estrase. And remember, this is all educational. I'm not giving anybody medical advice. Please remember that. But these are talking points to bring up with your healthcare provider. So, for example, if the menopausal symptoms you're having are dyspareunia, pain with intercourse, or a lot of urinary tract infections or something to do with vaginal dryness, you could try estradiol, which is a cream that you use twice a week through a suppository, a vaginal suppository. And that may take care of the symptoms fantastically in terms of night sweats, eating a lighter dinner, cutting back on alcohol, less meat. Those are all things the Physicians Committee for Responsible Medicine, headed up by Dr. Neil Barnard, has a great study. It came out either this year or last year. I'm confused now. I've read too many articles in the last 2 years. But it was on a plant-based diet for menopausal symptoms, and they had better success with a plant-based diet than hormonal therapy. So you could ease into it with trying topical therapy, trying some modifications, and then seeing. But if you find the menopausal symptoms are really just, life-altering in a negative way, I would say try it and see, but it's about 50-50 in terms of your Crohn's. So fingers crossed yours don't get worse. Okay. Let's see. I want to make sure that I don't miss anybody's questions. What is the healthy or recommended number for going to the bathroom a day? You guys are speaking my language. I love talking about this. So I will say that you eat at least once a day. You should have a bowel movement at least once a day, ideally, but everybody's a little bit different, right? And some people have slower transit, slower motility. It really depends a lot on how you feel. So you can go every other day and feel fine, and you can go 3 times a day and not feel good. So it's sort of like saying, what's the ideal height for a woman? You can be 6'6" as a woman, be perfectly healthy, and you could be 4'6" and be perfectly healthy. But 6'6" could be associated with gigantism, and 4'6" could be associated with, problems with growth hormones. So it really depends on the setting. In my practice, I try to help my patients achieve stool nirvana, and part of stool nirvana is a bowel movement every day. So it's okay if you miss a day and it's 6 or even 5, but I think if you get, less than 5 a week, not per day, a week, that's a little bit problematic. And some people, if you eat a really healthy diet, you might be having 3 or 4 stools a day, and that's perfectly healthy, right? If you're hydrated and you exercise a lot and you eat a lot of plants. So if you are having 3 bowel movements a day and you feel great, excellent. If you're having 3 bowel movements a day and some of them are loose consistency and you're having pain and cramping, not so good. So again, depending on the setting, but ideally 1 a day. Okay, what else do we have? I'm so glad that you find the information helpful. Is it true that the microbiota never fully recovers after the use of antibiotics? This is a tricky one. In terms of going back to exactly how it was before, I would say that is more or less true. It is unlikely to go back to exactly how it was before. There are different times in your life when your microbiome is more resilient. First 3 years of life, not a resilient time. It's still forming. Up to about age 18, again, not so resilient. Between around, adulthood, 18, 45, 50, maybe up to 60, a little more resilient. As we get older, we know that more diversity in the microbiome is associated with less frailty and better aging. So that's a time, again, when antibiotics and things like that can be more problematic. But that doesn't mean if you're in your 40s and you take an antibiotic, it's not going to do any damage. It means it's going to do less damage than if you were 2 years old, okay? Typically. So I think what you're getting at with this question is the idea of antibiotics always being harmful. And that's correct, yes. An antibiotic is against biota bacteria. That's what they do. So to say that you can take an antibiotic and it's not going to harm any of your biota doesn't make sense. It's like saying you could pour water on something, it's not going to get wet, right? It is, maybe that wasn't the best analogy. I just thought of that because of my water bottle here, but it is what they do. So the degree of recovery will depend on a lot of things. The state of your microbiome, the length of the antibiotic course, the potency of the antibiotic. A broad spectrum antibiotic is going to do a lot more damage than a narrow spectrum antibiotic like penicillin. What other medications you take, how many courses of antibiotics you've taken in the past, all of these things. And all of these things should go into that discussion with your healthcare provider who's prescribing the antibiotic, right? So a lot of my patients have a history of Clostridium difficile, C. diff, which is this bacterial infection that can develop as a result of antibiotic use. And they're at risk for recurrent C. diff in the setting of antibiotics. Or they have Crohn's or ulcerative colitis or other autoimmune diseases, which often flare in the setting of antibiotics. So when they are having urinary tract symptoms and they go to see their internist or their OBGYN, they know that they need to call me before they take anything that they prescribe. And sometimes I have to have a conversation with one of my medical colleagues, not to lambast them or anything, but just to hip them to some other things going on, to say, hey, I know you saw so-and-so and they have a sinus infection and you're thinking, an antibiotic could help shorten the course, but here's the deal. Their Crohn's is not in great condition and this antibiotic is likely to cause them to have a flare. So how about we just watch it for a little while longer, right? So just having that kind of dialogue. I'm not here to tell anybody how to practice medicine, but to, in a collegial way, make suggestions so that we are arriving at a decision for our patient that is in their best interest. Because, medicine is we're in silos. I'm in my GI silo and they're in their, genitourinary silo or their lung silo. So sometimes just bringing it all together can be really helpful. But it's even better when the patient can also have that discussion with them too, right? So I love a well-informed patient who can advocate for themselves too. It's great. Okay. What about acne? My daughter started to suffer after she had pneumonia and had to take antibiotics. She had clear skin, now suffers from acne. Yeah, Kimberly, that is, my daughter is the same thing. If you've read my first book, Gut Bliss, or my second book, Microbiome Solution, you know the story of my daughter, C-section baby, tons of antibiotics at birth, minimal breastfeeding, tons of antibiotics the first 2 years. This is how I got here. This is how I went from a conventionally trained gastroenterologist to somebody who is very, very, very interested in the microbiome, because I saw what it did to my own daughter's health, how those multiple antibiotics combined with the C-section birth, minimal breastfeeding, because my breast milk dried up after about 6 weeks, and all those antibiotics she got from well-meaning doctors, but I saw the hit her health took. And I, really felt like we were moving down this direction of autoimmune disease if we didn't make a shift, which we did. And I'm glad to say she's a healthy 17-and-a-half-year-old now applying to college. But she did develop acne in, somewhere around 13, 14, 15, and it did get quite bad. And I am 100% convinced that a lot of the acne was related to those antibiotics. And of course, every dermatologist I took her to wanted to put her on antibiotics. And, a lot of them are friends of mine. So they were like, yeah, I know you're not going to like this. I'm like, yeah, this is not happening. Not happening. But there are some things that can be helpful. So dietary change is a big one. And, with teenagers, I don't know how old your daughter is, but she's a teenager. It's hard to get teenagers to not eat junk food. But dairy is a big one for acne. I mean, the data is very convincing now. Dairy and a lot of refined sugar. So if you can, I got my daughter to, quite a while ago, long time ago, we were doing oat milk and almond milk and so on. So as she got older and, Starbucks after school and all the friends are having lattes and whatever, she's really good about the oat milk and the almond milk and stays away from that. So that's one thing that can be helpful. And just cutting down on the amount of refined sugar is super helpful for the skin. There's some topical things that you can use, non-antibiotic. Some of the retinol products can be good. And I actually think what was marketed as Accutane in the past, it's now, it's a brand name, but the retinol in somebody who is what I would call antibiotic damaged can be a better option sometimes. So that drug is not without its problems, right? It causes birth defects, so you'd have to make sure your daughter, there's all kinds of stuff you have to sign your life away about, birth control, etc. It's a drug that we know can cause birth defects. There's, cause severe dryness, other potential problems, can damage your liver. So I'm by no means suggesting that Accutane or that class of drugs are great. But if you have a child who has had a great deal of antibiotic exposure and you're concerned about antibiotics in the microbiome, it may be a reasonable alternative. So what I would say is find a dermatologist who's willing to have that discussion with you, and also think about finding a good esthetician who can do some good facials and help your daughter with hydrating the skin and so on, because those things can go a long way too. And best of luck to her. I know it's so hard, right? It seems like, oh, it's just acne, it's a trivial thing, but it can lead to so much dysmorphia in terms of, when we look in the mirror at ourselves and we see all these blemishes. So it's something important to try and heal if we can. And so often I see acne, rosacea as a sign of an inflamed gut. So I think that's a great place to start. Of course, to a hammer, everything is a nail, right? Okay. Why do intestinal volvulus occur, and is there any way to prevent them? Man, you guys have some great questions. You could go into practice with me. An intestinal volvulus is a twisting, a kinking of the intestine, and it typically will happen if the colon is a little floppy. The colon is tethered to the abdominal wall and the back of the abdominal wall by a mesentery. I don't know how to describe that. It would be like, this is the gut here, and then the mesentery is attaching it back here. I know this didn't do a good job with that, but that's what keeps the gut from just flopping all over the place, right? It is tethered. It can still move, but it is tethered. And so if you have a very long, what my colleagues like to call a redundant colon, that I like to call a voluptuous venous colon, with a lot of loops and twists to it, it can volve. You can get a volvulus that way. And anatomically, some people have longer, floppier colons. Constipation can be a precipitating factor for a volvulus, so can inactivity. So sometimes something we see in residents of nursing homes, etc. But yes, there can be ways to prevent them, and that will be, making sure the bowels are moving regularly, that the motility is intact, etc. But it will depend a little bit. A volvulus can occur as a result of a tumor, not suggesting that's what you have, but there are instances too where there's a tumor that's, of the bowel that's causing it. So this is one I need more specifics to go into, but I'm glad you brought that up. Okay. Lots of pimples, which keeps popping on face and back, age is 40, male, belly fat. What should be ideal diet to reduce the fat? Okay, so an ideal diet would be one where you're really increasing the amount of fiber that you're eating. And so maybe substituting one meal a day, like taking lunch and having a salad for lunch every day would be a great way to do that. And if you're increasing the amount of plants in your diet, I think that will help a lot with the pimples too. Maybe think about cutting back on dairy. I don't know your diet, but if you are eating a lot of dairy, that can contribute to belly fat, and that can also contribute to pimples. So I hope that was helpful. Hyperacidity. Any gap in meals leads us to headaches. Yeah, so, the headaches can also be hypoglycemia sometimes too, but in that case, I'd recommend trying to eat more frequent small meals to try and keep that under control. X-ray showed backed up stools and colon, but don't feel constipated. Find it hard to eat too much fiber right now. So you may actually benefit from more liquid and less fiber. If the X-ray is showing a backup, and you don't feel constipated, and you don't feel like eating a lot of fiber, that's probably a sign that your colon is pretty full, and just doing more liquids may help. It's like plumbing. When the pipes are clogged, sometimes you just need some liquids to flush it all through. So taking, doing maybe soup for dinner, like even a broth for dinner, and lightening it up a little bit until you can empty might be helpful. All right. And I'm going to stop in just a few minutes, but these are such great questions. PPI for severe issues, whole foods, plant-based, I'm worried I'm now more susceptible to illness. Is there anything else I can do for this period of time that I need to be on the meds? So what I would say is, so proton pump inhibitors, these acid blockers, and yes, they do make us more susceptible to viruses because they remove stomach acid, which is one of the main host defenses, right? Stomach acid denatures viral protein and renders it inactive. So the reality is, yes, you are a little more susceptible there, but the good news is you're also whole food plant-based and ideally eating lots of plants. So that is something protective, all those different plant foods. And what I would ask about is, how long do you have to be on the PPI? Could you do alternate dosing, meaning taking it every other day? And what about an H2 blocker? Because we know that those drugs like Pepcid are not as problematic, okay? So ask about those things. Thanks for sharing. Okay, we have so many good questions, but I am gonna have to dash. I'm so sorry. We're at 12:45, and I do have to just because the book is out today, yay, Antiviral Gut. So I do have to do some little promotional things for the book, but it's been fantastic joining you guys. You know, I'm not an avid social media user, and all of this is somewhat new to me, but I only wish that I could actually see you guys and we could all be together, because I love sharing this information. You ask such fantastic questions, and it really is a privilege and an honor for me to be able to share what I know. And again, it's educational. I'm not giving you medical information, but hopefully I'm arming you with some good information to go and talk to your healthcare providers about and to think a little bit more about, because power to the people, that's what I'm about. I want to put the power in your hands to have a healthier gut, a healthier microbiome, to be more resilient. And it's the whole reason I bought this book, The Antiviral Gut. So do me a little favor, please buy the book this week so that the numbers will look good for my publishers. And really, it is a book I'm very proud of, and I think it's got lots of great information there, and I hope you get it. Okay, thanks so much. I'll see you next week. Bye.